So today we are discussing about the oculomotor nerve. We know that oculomotor nerve is the third cranial nerve, and the oculomotor nerve, it supplies all the muscles of the eyeball except superior oblique and lateral rectus muscle. It supplies all the extraocular muscles of the eyeball except superior oblique and lateral rectus muscle. Here is the superior oblique. Here is the superior oblique muscle, okay, except superior oblique and lateral rectus muscle. It supplies all the muscles of the eyeball except the superior oblique and lateral rectus muscle. Except these two muscles, it supplies all the muscles of the eyeball. Okay, so this is the superior oblique muscle and this is the lateral rectus muscle, and here we have medial rectus is present here, and here we have inferior rectus is present here, and this is the inferior oblique is here, and this is the superior oblique, and this is the superior oblique, and below one is the not superior oblique, it is levator palpebrae superioris, and the below one is the superior rectus muscle. Okay, so it supplies all the muscles of the eyeball except superior oblique and lateral rectus. These superior oblique and lateral rectus muscles, they are not supplied by the oculomotor nerve. Okay. Next, so what are the functional components of the oculomotor nerve? So coming to the functional components, somatic efferent column. So somatic efferent column is one functional component which supplies the somatic efferent column which supplies the extraocular muscles of the eyeball. Okay, somatic efferent column which supplies the extraocular muscles of the eyeball. That is one functional column. One is somatic efferent column. Somatic efferent column. Okay, and the next one is proprioceptive sensations from the proprioceptive sensation. Proprioceptive sensations. Okay, so the proprioceptive sensations from the muscles of the eyeball, they are carried to the mesencephalic nucleus. Mesencephalic nucleus is the trigeminal ganglion. Mesencephalic nucleus. Okay, so the proprioceptive sensations, they are carried out by the mesencephalic fibers, and the fibers they further relay in the mesencephalic nucleus. Mesencephalic nucleus. Okay, proprioceptive sensations from the eyeball, and the third functional component is special visceral efferent. Special visceral efferent which carries preganglionic parasympathetic fibers. Which carries preganglionic parasympathetic fibers, and these after relaying in the ganglion, after relay in the ciliary ganglion, the postganglionic fibers, they supply the ciliaris muscle as well as the sphincter pupillae. So three functional components are present. One is somatic efferent column which supplies the extraocular muscles of the eyeball, and proprioceptive sensations from the muscles of the eyeball which carry out to the mesencephalic nucleus, and the special visceral efferent fibers, nothing but the preganglionic parasympathetic fibers, would supply the sphincter pupillae as well as ciliaris muscle after relaying the ciliary ganglion. Okay, so coming to the nuclear origin, coming to the deep origin, the oculomotor nuclear complex. Okay, the oculomotor nucleus complex, it is in line with the 4th, 6th and 8th cranial nerves and also ventral roots of spinal nerves. What are the components? What are the nuclear components? What are the nuclear origins? One is dorsolateral segment which supplies the inferior rectus muscle. Dorsolateral segment which supplies the inferior rectus muscle, and the intermediate nucleus. One is the oculomotor nucleus consists of a nuclear complex. Okay, not only one nucleus, it is nothing but a constitution of a nuclear complex. So what are the nuclear complexes? What are the nucleus? One is dorsolateral nucleus, one is dorsolateral segment which supplies the inferior rectus muscle. That's why I have represented with IR. Okay, and next one is the intermediate segment which supplies the inferior oblique muscle. Intermediate segment which supplies the inferior oblique muscle, and the next nuclear segment is the ventromedial nucleus which supplies the middle rectus. And also we have median raphe nucleus which supplies the superior rectus, and central caudal segment nucleus which supplies the levator palpebrae superioris. These are the nucleus of motor origin, right? So Dorsolateral segment it supplies the inferior rectus, and intermediate segment which supplies the inferior oblique, and the ventromedial segment, ventromedial nucleus which supplies the middle rectus, and caudal central nucleus which supplies the levator palpebrae superioris, that way I represented with LPS, levator palpebrae superioris, levator palpebrae superiorris, and also we have Edinger-Westphal nucleus. Edinger-Westphal nucleus, it conveys preganglionic parasympathetic fibers. Preganglionic parasympathetic fibers, and these preganglionic parasympathetic fibers, they relay in the ciliary ganglion. Okay, so the motor nucleus complex consists of how many nucleus? 1, 2, 3, 4, 5, 6. The motor nucleus complex consists of 5 nucleus. One is dorsolateral nucleus, which supplies the inferior rectus. Next one is intermediate nucleus, which supplies the inferior oblique. Next one is ventromedial nucleus, which supplies the middle rectus, and the next one is the caudal central nucleus, which supplies the levator palpebrae superioris, and also medial raphe nucleus, which supplies the superior rectus, and Edinger-Westphal nucleus, which conveys preganglionic parasympathetic fibers. Okay, and coming to the superficial origin. Coming to the superficial origin, here the nerves fibers, they undergo a series of lateral curves along the tegment of the midbrain, and they pass along the lateral side of the, and they pass along the lateral part of the red nucleus, medial part of the red nucleus, substantia nigra, and here they pass on the medial wall of the basins pedunculi, and here from the superficial origin, here the nerve passes in the interpeduncular cistern between the superior cerebellar and posterior cerebral arteries, and here the nerve accompanies the lateral part of posterior intercommunicating artery. This is the posterior communicating artery. Posterior communicating artery. Okay, and here the nerve passes between the superior cerebral and posterior cerebral arteries, superior cerebellar and posterior cerebral arteries, and here the nerve lies lateral to the posterior communicating artery, and here what happens here is the nerve here, it pierces the arachnoid matter, and it enters into the trigeminal oculomotor trigo. It enters into a triangular area between the attached and free margins of the tentorium cerebelli, and here the nerve pierces the meningeal layer of dura mater, and here it enters into the cavernous sinus, and here in the cavernous sinus it runs along the cavernous sinus, it pierces the lateral wall of the cavernous sinus, it runs to the anterior part of the cavernous sinus. In the anterior part of the cavernous sinus, the nerve divides into two branches. These two rami, they pass within the common tendinous ring of the superior orbital fissure, and here they supply the muscles of the eyeball. So from here the nerve fibers from this complex origin, they undergo a series of lateral curves through tegment of midbrain, red nucleus, substantia nigra, and on reaching the basis pedunculi, the nerve fibers unite to form a trunk, and in the internal peduncular cistern, it passes in between the superior cerebellar and posterior cerebral arteries, and here it pierces the meningeal layer, and it pierces the arachnoid matter and occupies the ocular triangular area between the attached and free margins of the tentorium cerebelli, and here the nerve, it pierces the meningeal layer of dura mater and pierces the lateral wall of the cavernous sinus, and in the anterior part of the cavernous sinus, here the nerve divides into two rami, superior rami and inferior rami. Superior rami and inferior rami, they get separated by nasociliary nerve. These superior rami and inferior rami, they pass through the common tendinous string of the superior orbital fissure, which are separated by a nerve called, this nerve is the nasociliary nerve. We know that nasociliary nerve is a branch of ophthalmic nerve, which is in turn is a branch of trigeminal nerve, right? So the nerve passes here, and finally it divides into superior ramus and inferior ramus in the anterior part of the sinus, and here the nerve, the superior ramus, it passes lateral to the optic nerve. Here what I have represented with blue dot is the optic nerve. Here is the optic nerve. And the superior ramus, it supplies the superior rectus muscle as well as the levator palpebrae superioris. And coming to the inferior ramus divides into three branches. One branch passes below the optic nerve and supplies the medial rectus muscle, and the other branch, it supplies the inferior rectus muscle, and the large branch, the third branch is the large branch, it supplies the inferior oblique muscle as well as it provides a communicating branch to the ciliary ganglion. Here is the, we have ciliary ganglion is situated here and it provides a communicating branch to the ciliary ganglion. Okay. So, the two divisions of the oculomotor nerve, they pass through the common tendinous ring of the superior orbital fissure. In between the two divisions, we have nasociliary nerve is present in between the two divisions. And coming to the superior division, it supplies the superior rectus as well as the levator palpebrae superioris muscle. And coming to the inferior division divides into three branches. One branch supplies the medial rectus muscle, and the second branch supplies the inferior rectus muscle, and the third branch is large branch, it supplies the inferior oblique muscle here, and also it supplies the communicating branch to the ciliary ganglion. Okay. So, that's about the divisions, the two division of the oculomotor nerve and how they supply. Except all the muscles, all the oculomotor, all the extraocular muscles of the eyeball, they are supplied by the nerve through its ocular surface, except inferior oblique, which is supplied from its posterior border. Okay, all the ocular muscles are supplied by the oculomotor nerve from its ocular surface, except inferior oblique, which is supplied by the inferior ramus of the oculomotor nerve through its posterior border. Okay, so from the nuclear complex, here the fibers undergoes a series of lateral curves and they pass. Where is the nucleus of the oculomotor nerve situated? The nucleus of the oculomotor nerve is situated in the ventromedial part of the periaqueductal grey matter of the midbrain, central periaqueductal grey matter of the midbrain at the level of superior colliculus, So the oculomotor nucleus, it is situated in the ventromedial part of the periaqueductal central grey matter of the midbrain at the level of superior colliculus. Okay, and here from the nucleus we know that the oculomotor nerve has a complex motor nuclear complex. We have more number of nuclei present, and here we have more number of fibers arrayed from here. And the fibers from the nuclear complex, they undergo series of lateral curves through the segment of midbrain, red nucleus and the substantia nigra, and at these fibers, they unite to form a trunk on the medial side of the basis pedunculi, and in the interpeduncular system it passes, and here the oculomotor nerve invested by a sheath of pia mater, and in the interpeduncular system it passes in between the superior cerebellar and posterior cerebral arteries, and it occupies the lateral part of the posterior communicating artery, and here the nerve pierces the arachnoid matter at the junction of the attached and free margins of the tentorium cerebelli triangular area, and here the nerve after that the nerve pierces the meningeal layer of dura mater and enters into the cavernous sinus just lateral to the posterior clinoid process, and here it is related to the internal carotid artery as well as maxillary, ophthalmic and trochlear nerves. This is trochlear, maxillary, and this is ophthalmic, and this is the abducent, and this is the internal carotid artery. Okay, right? And at the anterior part of the sinus, the nerve divides into two rami, superior rami and inferior rami. These superior rami and inferior rami, they pass through the common tendinous ring. These superior rami and inferior rami, they get separated by the nasociliary nerve. The superior ramus, it supplies the levator palpebrae superioris and superior rectus, and the inferior ramus divides into three branches. The first branch supplies the middle rectus muscle, second branch supplies the inferior rectus muscle, and the third branch is long branch. It supplies the inferior oblique muscle as well as it provides a communicating branch to the ciliary ganglion. Okay, so That's about the branches, divisions of the branches of the oculomotor nerve. And one more thing is the oculomotor nerve receives central connections from the cerebral cortices. It receives central corticonuclear fibers. What are the central connections of the nucleus? What are the central connections of the oculomotor nerve? Means corticonuclear fibers, corticonuclear fibers from the motor cortices of the cerebral hemisphere, corticonuclear fibers, and also from the medial longitudinal fasciculus. It also, the oculomotor nucleus, it also receives fibers from the median longitudinal fasciculus, through which is connected to the 4th, 6th and 8th cranial nerves for the proper coordination of the eyeball. And also the oculomotor nucleus, it receives fibers from the tectobulbar tract. It also receives from the tectobulbar tract, through which it is connected to the visual cortex, which is important for the visual protective reflex. Through superior colliculus, it is connected to the visual cortex, which is important for visual protective reflex. Okay, so those are the central connections of the oculomotor nerve. Okay, one is corticonuclear fibers, medial longitudinal fasciculus and tectobulbar tract. And also it also receives from fibers from the pretectal nucleus. Okay. So those are the central connections of the oculomotor nerve. And here we know that the motor nuclear complex consists of more number of nuclei. Here I have represented with a schematic diagram. One nucleus is the dorsolateral nuclei, which supplies the inferior rectus muscle, and this is the intermediate segment nucleus, which supplies the inferior oblique, and this is the ventromedian nucleus, which supplies the middle rectus muscle. And we have caudal central nucleus, which supplies the levator palpebrae superioris, and we have median raphe nucleus, which supplies the superior rectus muscle, and we have Edinger Westphal nucleus, which conveys preganglionic parasympathetic fibers. Okay, so that is the course and divisions of the oculomotor nerve. And here, what are the communications of the oculomotor nerve? Okay, so what are the communications of the oculomotor nerve is, it communicates, the oculomotor nerve, it communicates with the nasociliary nerve here, it communicates with the nasociliary nerve here, and also the oculomotor nerve, it communicates with the internal carotid artery. With the internal carotid artery, it communicates with the internal carotid artery. And here we can see internal carotid artery is present here in the cavernous sinus. So it communicates with the sympathetic plexus present around the internal carotid artery, and also it communicates with the nasociliary nerve. And the oculomotor nerve, it also communicates with the ciliary ganglion, which conveys preganglionic parasympathetic fibers. Okay, so that's about the communications of the oculomotor nerve. Okay, next. So, coming to the communications, we have discussed, we know that communications, it communicates with the sympathetic plexus around the internal carotid artery, and also it communicates with the ciliary ganglion, which conveys preganglionic parasympathetic fibers, and the proprioceptive sensations from the extraocular muscles, they are conveyed by the trigeminal, they are conveyed by the oculomotor nerve. And here it communicates with the ophthalmic nerve, so the fibers, they pass without interruption to the trigeminal ganglion, and finally the fibers reach through the mesencephalic nucleus of the trigeminal nerve. The neurons, they are situated, the neurons of the fibers, the cell bodies of these fibers, they are situated in the mesencephalic nucleus of the trigeminal nerve. So it communicates with the ophthalmic nerve for the proprioceptive sensations of the extraocular muscles. Okay, so that's about the communications. And now coming to the ciliary ganglion. Okay, so the ciliary ganglion, we know that the ciliary ganglion, it is situated, it is the size of the pinhead. Like it is a small ganglion of all the 4 trigeminal ganglion. The size of the ciliary ganglion, it is nothing but a pinhead, and it is situated in the apex of the orbit. It is situated in the apex of the orbit, and the ciliary ganglion, here it receives 3 roots. One is sympathetic, parasympathetic and sensory root. Coming to the, so ciliary ganglion consists of 3 roots: sensory, sympathetic and parasympathetic. Okay, parasympathetic. Coming to the sensory through the nasociliary nerve, it conveys sensory fibers. And next one is the sympathetic nerve. Sympathetic nerve, the post-ganglionic sympathetic fibers, they reach the ganglion through the plexus around the internal carotid artery. Okay, the plexus around the internal carotid artery, the post-ganglionic parasympathetic fibers, they reach the ganglion. And here parasympathetic fibers, we know that from the laryngeal vestibule nucleus, the parasympathetic fibers, they reach the ganglion through nerve to inferior oblique. Okay, the nerve to inferior oblique, through the nerve to inferior oblique, the preganglionic parasympathetic fibers, they reach the ganglion and they relay in the ganglion. And the sensory nerve fibers and sympathetic fibers, they don't relay in the ganglion, right? So we know that the sympathetic fibers, they already relay in the they already relay in the ganglion, superior cervical, middle cervical, and inferior cervical. The sympathetic fibers, they relay in the superior cervical ganglion, and the post-ganglionic fibers, they pass through the ganglion and they supply the muscles of the, they supply the arteries of the eyeball, blood vessels of the eyeball, and also they supply the dilated pupillae. Okay. And coming to the preganglionic parasympathetic fibers, these preganglionic parasympathetic fibers, they pass through the ganglion to the nerve to inferior oblique, and the post-ganglionic fibers, here they divide into 15 to 12 ciliary branches, and the post-ganglionic fibers, the ciliary ganglion divides into post-ganglion 15 to 20 ciliary branches. From 15 to 20 ciliary branches, they pierce the choroid and sclera. They occupy the space between the sclera and the choroid, and they supply the sphincter pupillae and the ciliaris muscle. And 95% of the post-ganglionic fibers, they supply the ciliaris muscle. Only 5% they supply the sphincter pupillae. So ciliary ganglion consists of sensory route through nasociliary nerve and sympathetic route through internal carotid artery, plexus around the internal carotid artery, parasympathetic nerve through nerve to inferior oblique. So it is topographically related to the nasociliary nerve. Ciliary ganglion, it is topographically related to nasociliary nerve. Topographically related to nasociliary nerve, but functionally it is related to the oculomotor nerve, because the preganglionic parasympathetic fibers, they are carried out by the branch of the oculomotor nerve, nothing but the inferior nerve to inferior oblique, which carries fibers from the laryngeal vestibule nucleus, and they relay in the ganglion. And the post-ganglionic fibers, they supply the space, they enter into the space between the choroid and sclera, and they supply the strictures over there. They supply the sphincter pupillae as well as the ciliaris muscle. So that's about the oculomotor nerve.